Hello and welcome to our first live broadcast for a video in the educational channel. Actually, this video is not as we promised before. It is not about the biomolecular medicine. However, it is much related to the same field. The trigger to this live video, and I meant to make it live, is a video I saw an interview with one doctor from Denmark. He was talking about the corruption of the pharmaceutical companies and how they are controlling the market, how they are controlling the prescriptions, and some of the lawmakers, some of the presidents, some of the ministers, so that they have influence to the market more than they should. The problem is much bigger than pharmaceutical company and lawmaker. It's much bigger than this. Actually, medical research field totally is corrupted after what we call globalization. Globalization, which came by new rules, and we started to hear this terminology in the last decade of the last century, extended with us for a few years, then we stopped hearing it. As every bubble created in the world, bubble of globalization, however, the consequences of the globalization, especially in the medical research field, was more than any imagination in this time. I used to follow up the information about the news, about how they are going to change the medical field and how they are going to change medical research. And we all know that after the Second World War, when the new guidelines for for clinical trials were created, and I cannot blame anyone for creating rules. The opposite, actually, I support having rules in the medical field to avoid what happened in the Second World War of trying medicine and unhuman experiences on the war prisoners, and how the mass graves and the catastrophic results of some medicine and some procedures and some new machines. We all have an idea about this. But it is like when you create a rule and there are some professionals in how to use the rule, how to bend the rule for their own benefit. Actually, the problem of the medical research is much bigger than any imagination today. And it needs a revolution from all the doctors if we can do it. And if we can cooperate to come back one step and reorganize the entire story from the business, and I'm sorry to use this terminology, but the money laundering happening in the medical field today, abusing the clinical researches, the conferences, the publishing. This all is corrupted today. This all need a revolution today. The problem is much bigger than our imagination. The problem is much bigger than we hope it can stop one day. Personally, I attended one of the conferences, three days conference, and I was invited as a keynote speaker and in the organizing committee. I had to discuss with some doctors in the session that I was the president of it. This conference was supposed to be about the new drugs, new discoveries in drugs. What I can say is, I'm going to attend a medical conference, and for 3 days, I didn't hear anything clinical. I couldn't have one take home message to use it in my clinic. I remember in the 90s and in the beginning of the 2000, up to 2005, we used to go to conferences, learn, and really see new clinical information. And the take home message affected our clinical practice in a big way, affected our prescriptions. I used to change my prescription after each conference to whatever I heard new of something valuable, of better use, or. But this 3 days conference, I didn't hear anything I can take as a home message. The opposite. What I saw is just some scientific fantasies. It is science. It is supposed to be in the pharmaceutical field. However, it is so far from any clinical application. It is so far from any clinical use on the ground to the patient. When we talk about medicine, we need to imagine the doctor in the clinic face to face with the patient. The patient who is coming have nothing in his mind except getting better, to be treated,